Hello, this is Elridge Proctor, the Senior Director of Government Affairs and Public Policy at GO2 Foundation for Lung Cancer. Formerly, we were known as Lung Cancer Alliance, and today I'm here to talk to you about an issue that is of great importance to the lung cancer community. As you know, Lung Cancer Alliance in its previous form worked hard for well over a decade in advocacy to bring the issue of lung cancer as a disease to the forefront of the minds of members of Congress, the news media, and the general public. As you may know, our impact to date includes federal legislation that actually directed and authorized the director of the National Institute of Health, National Cancer Institute, NCI, to develop a scientific framework for research in lung cancer. This is the actual framework in small cell that today has brought about developments to treat an area that was underrepresented where no treatment existed before in lung cancer. In addition, the organization had established the first ever federal research funding pipeline for the lung cancer research program within the congressionally directed medical research programs administered by the Department of Defense. This program now is the second largest lung cancer research program, both public or private, outside of the NCI and NIH. The organization also led a 10-year advocacy effort to successfully secure lung cancer screening for early detection of lung cancer as a fully covered preventive services. Then the organization went on to establish the first ever Congressional Lung Cancer Caucus in the U.S. House of Representatives and began hosting its congressional briefing series to educate Congress and the public about the community's issues. To date, the organization has introduced the first ever Women in Lung Cancer Research and Preventive Services Act. This is what I'm here to talk to you about today. We're also launching this as the Save Her Lungs campaign. To begin, I want to bring you to where we are as GO2 Foundation for Lung Cancer. We stand by empowering everyone, and we ignore no one in advocacy in the work that we're doing as an organization. Our mission statement is simply transforming survivorship by saving, extending, and improving the lives of those vulnerable, at risk, and diagnosed with lung cancer. Our Save Her Lungs campaign is inspired from the stories that we've heard from the community and those who have joined us in advocacy. Michelle from Magnolia, Texas, diagnosed in 2015 at the age of 35 with stage 4 lung cancer, is a prime example of why we're launching Save Her Lungs. The facts about women and lung cancer is real. We already know that lung cancer is the leading cause of cancer deaths among women. Each day, the startling average of 181 women die from lung cancer in the United States. If you're keeping time, that's one death every 8 seconds. That's one death too many. This number is represented by an estimated number of 66,020 deaths this year alone in 2019. This is nearly as many deaths caused by other larger cancers combined. And yet, lung cancer is the least funded cancer in terms of research dollars per death of all other major cancers. And it's also one of the diseases where patients are routinely blamed for their condition, while lung cancer in never smokers, we know, is the 6th leading cause of cancer deaths. So I want to share a background with you, how the organization took on the issue of women and lung cancer. So what put the ball in motion in crafting the first ever legislation on women and lung cancer was a groundbreaking study in 2010 published by Brigham and Women's Hospital, which revealed to us that not only was lung cancer the leading cancer killer in the United States, but that lung cancer kills more women than any other cancer. And at that time, nearly 200 women were dying each day. The report revealed, in comparison to a heart disease, that lung cancer actually was a hidden women's cancer. where little was known and the issue was rarely discussed or even looked at. What you're looking at is a timeline of this introduction. So in 2010, the Brigham Women's Hospital research reported a higher incidence of women of lung cancer. And then in 2016, it went on to update that report. The difference between the 2010 and the 2016 was that the 2010 issued a call to action that distinctively said it is time to bring lung cancer out of the shadows. The 2016 report that was updated confirmed lung cancer as a women's health imperative. At that time, LCA responded to that call to action, partnered with the report, and issued the authorizing of the first legislation back in 2016. Up top, you're seeing the numbers of the respective bill numbers. So in 2016, the Women in Lung Cancer Research and Preventive Services Act was introduced as HR 5263 and Senate Bill number 2941. Then the session expired in 2016. So in 2017, the bill was not able to be reintroduced due to the time spent on healthcare reform. However, with the earliest opportunity to reintroduce the bill in 2018, it was then introduced as HR 4897 and S 2358, also with the same title, Women in Lung Cancer Research and Preventive Services Act of 2018. 2018 marked a significant achievement with the level of support received. The bill was then endorsed by ACS-CAN and the LungCan groups. And then at the start of the summer in 2018, the New England Journal of Medicine published new study findings of higher incidence in women than in men in the US. This gave us a lot more authority to be able to speak about this issue. So then in 2019, with the new startling facts that an estimated 66,020 women will die of lung cancer, which is equivalent to 181 women dying each day, still one every 8 minutes, the organization went on to have the bill reintroduced as the Women in Lung Cancer Research and Preventive Services Act of 2019, which is now HR 2222 and S 1107. This bill has already received endorsements by ACS-CAN and 17 organizations, and still working to get more support. Now, I want to come back to the study that was published. Higher incidence of lung cancer in women is what was reported in the New England Journal of Medicine. The study specifically focused in on the incident rates of lung cancer among white and Hispanic women born after 1965, with a higher incidence than their male counterparts. The significance of this finding, published on May 24, 2018, signaled that even the authors of this research were calling for more research to be done, more gender, more specific research to be done in order to understand why this higher incidence. And so our aim and objective with the Women in Lung Cancer Research and Preventive Services Act of 2019 is to answer that very scientific question. The bill was reintroduced, as you know, as S 1107 or HR 2222 by Senators Rubio from Florida, Senator Feinstein from California, Congressman Boyle from Pennsylvania, and Congressman Fitzpatrick, also from Pennsylvania, along with 5 other original co-sponsors, Senator Capito, Senator Manchin, Representative Bonamici, Representative Dingell, and Representative Rutherford, making this both a bicameral in both houses and bipartisan, with both Democrats and Republicans leading this legislation. So what does the legislation do? It simply requires the Secretary of Health and Human Services to conduct an interagency review to evaluate and identify opportunities for increased research on women and lung cancer, improved access to preventive services, and to develop and conduct a national public awareness and education campaign. The legislation simply conveys a powerful need for our community. This is something we speak and advocate for each and every day, that more research dollars in lung cancer, especially in underrepresented areas, must be allocated. It prioritizes the work being done currently in federal agencies as it compares and reviews past research to current research in order to identify the gaps. And then number 3, it calls for a comprehensive and coordinated plan of action in order to reduce the impact of this disease. Going into this year, we stand on the milestones established in 2018. Back when the bill was introduced last year, nearly 4,000 advocates sent letters to Congress. Advocates from all over the country that included both men and women in support of this legislation. We convened over 120 advocates from 30 plus states and over 150 meetings on Capitol Hill during the organization's 10th National Advocacy Summit last July. We also secured 52 bipartisan co-sponsors of the House bill, H.R. 4897, and 10 co-sponsors of the Senate bill, S. 2358. And what most people don't know, but you're learning it here, is that we secured bill report language in the fiscal year 2019 appropriations bill to encourage the Secretary of Health and Human Services to act on the provisions of the bill. So while we're trying to get the bill enacted as law, we are also speaking to federal agencies to bring this issue before them and to encourage them through report language to start putting in plans to act on the provisions. Currently, we have launched the Save Her Lungs campaign. It's our 2019 campaign to bring greater awareness and support to this legislation so that it can advance this year. Thus far, nearly 2,000 letters have been sent in the first 4 months of reintroducing the bill with the new numbers, H.R. 2222 and S. 1107. This is the Women and Lung Cancer Research and Preventive Services Act of 2019. 10 bipartisan co-sponsors in the House and 3 in the Senate, with more being added with each passing week. As you know, the bill has been endorsed by ACS-CAN and 17 other organizations and working to get more. We are at a time where there's historic number of diverse women in Congress. But this is also at a time where the number of never smokers and young women with lung cancer continues to rise in this country. There are things that we each must do, and there's a role for you as advocates. The Save Her Lungs campaign allows you to join us. Come and visit our website. Send a pre-written letter to your representative and senators to ask for support. You can keep the national dialogue going by using the hashtag Save Her Lungs on your social media. Register for the upcoming National Advocacy Summit to go to Capitol Hill on July 23rd. You must learn the facts and figures to advocate effectively and to share lung cancer stories. We have a number of resources on our website that you can utilize. We have a webpage titled How to Become an Advocate for anyone seeking the opportunity to advocate on this issue, as well as the funding issue and any other issues that the community cares about. You also can go to the tab Advocacy, click on our legislative priorities, and you'll arrive directly at the Save Her Lungs webpage, and you can take action there directly. I'm pleased to present as much information as needed so that each individual can be empowered to take action. At the conclusion of this short webinar, just want to share with you some common Q&As and FAQs that you can also download from the Save Her Lungs webpage. So we've been asked specifically about the legislation, why is it that we are seeking a coordination between the Department of Defense and the VA, and why we are calling for an interagency review? The reason for that is, first, we want to be able to have a comprehensive review of previous research, pinpointing knowledge gaps and areas that may need further exploration. The recommendations that will come from this report will be made regarding research and innovative approaches and environmental and genomic factors. It will also talk to us about access to advances in imaging technology, diagnosis, and treatment. We will also have the opportunity to raise public awareness and educate the public more about what can be done. We need to educate about the access to a national lung cancer screening strategy, particularly for those in underserved or hard to reach areas. The other questions that we have been asked deals with, why are we specifically looking at the National Cancer Institute and the Department of Defense? And the reason why is there, within these two agencies, are the largest lung cancer research programs. It goes without saying that the NCI is one of the world's premier cancer research institutes, but it may not be as intuitive as the Department of Defense lung cancer research program that is a dedicated pipeline. The DoD, Department of Defense, has a robust and highly respected biomedical research that is armed and coupled with comprehensive infrastructure and oversight, and a strong dedication to the health and well-being of members of the armed services, and the information gathered there will also benefit the general public. The DoD is unquestionably the right partner for NCI, as the two agencies can work together to develop the best recommendations to combat and prevent lung cancer among women. The third question has been, where does this fit within the priorities of Health and Human Services and other agencies or research funding? Well, given the unique impact that lung cancer has on women, particularly non-smoking women, I think it is important to raise the level of priority for what's currently being done within these agencies to get a better understanding of existing research and the knowledge gaps to guide our approach to addressing the disease most comprehensively. This is not meant to be at all exclusive of the general population. The Go-To Foundation for Lung Cancer represents men, women, and not only patients, but also their families and caregivers. We represent the disease holistically, and we're approaching it from a very comprehensive and coordinated pathway. And this is what we're calling for through this legislation. We see this as a partnership to create a comprehensive programs of research, lung cancer preventive services, and public awareness and education on lung cancer. We recognize there are many unmet needs for the lung cancer community. Those that are noted in the bill are just some of the urgent priorities that we would like to highlight. However, it is not a substitute or a mandate that will take away from other priorities currently being served and currently being looked at to serve the lung cancer community. With that said, I am going to stop here and allow you to visit our resources on the Save Her Lungs webpage. And we'll end with a little bit about me. Please contact me if you have any questions. I'm Elridge Proctor, the Senior Director of Government Affairs and Public Policy, and you can reach me at eproctor@gotofoundation.org. Thank you.